Today's lecture this is lecture 2 of the disorders of the hair and the scalp. This is a level 1 course. We're going to talk about furuncles and carbuncles, and we're going to continue our disorders. So, a furuncle and a carbuncle is very simple. Similar. A furuncle is a boil, is an acute bacterial infection of the hair follicle, producing constant pain. A carbuncle is the result of an acute deep-seated bacterial infection in subcutaneous tissue. The difference between the two is the carbuncle is a little bigger than the furuncle. Okay, this is really what I want to talk about today. We want to talk about basic hair and scalp analysis. These are some of the things that you're going to need: sight, hearing, smell, and touch. Okay, let's go here. Sight. Why do you need sight? Observation will impart some knowledge immediately, such as whether the hair looks dry or oily. Hearing. Talk to your client. Smell. Certain scalp disorders will create an odor. And touch. You must have a touch to analyze the condition and the texture. Okay, of course, we understood hypertrophies such as moles and warts require extreme care when combing through the hair. So you want to make sure that you pay attention to any hypertrophies. Do not proceed with chemical service if there are signs of abrasions or irritation. If parasites are present, of course, we know to refuse the service. Okay, texture. You got different types of texture: coarse, medium, and fine. Coarse, okay, the texture refers to the degree of coarseness or fineness of the hair strands. It is measured by the diameter of the hair strand. Coarse hair has the largest diameter. Medium is in the middle, and fine is there. Is the smallest. How do you test? This is how you test. You feel a single strand of dry hair between the fingers. Hold the strand securely with one hand while rolling it between the thumb and the forefinger. With practice, you'll be able to determine the difference between coarse, medium, and fine hair textures. Okay. Density is the number of individual hair strands per inch. Is classified as either thick, average, or thin, or they might say high, medium, or low density. So, high density. If the hair is thinning out, that's low density. High density is a whole bunch of hairs in a particular area. Is very important. Porosity represents the ability of the hair to absorb and to also retain moisture. This is directly related to the condition of the cuticle of the hair. If you talk about the hair structure, it's three parts. You have the cortex, the cuticle, and the medulla. The cuticle is the outer layer. The cuticle actually helps to protect the cortex, which is the way where chemical changes take place in the hair. Okay, normal, this is average. That means the cuticle is slightly open. No special problems and no chemical application is usually expected. Low porosity hair, that means the hair is resistant. The cuticle is considered closed. So you want to be able to penetrate through that cuticle to get to the cortex. How do you do that? You may require a more alkaline solution. So in hindsight, that means okay, yeah, I'm going to use a regular relaxer, but for resistant hair, I may need a super relaxer because I need a stronger product or a more alkaline product to penetrate through the cuticle to get to the cortex where the hair is trying to change. Okay. Now, high porosity means if you look at this picture, the cuticle is wide open. That means the hair is considered overly porous and is usually the result of over processing. This hair is considered dry, damaged, fragile, and brittle. So, what do? Use a reconditioning treatment. We got a deep conditioning treatment that we use. So, use that. Testing for porosity. This is the example. You take multiple strands of hair, and if the hair feels, you run your thumb and forefinger. If the hair feels smooth and the cuticle is compact, it is considered resistant. If you can feel a slight roughness, that's normal because the hair should be porous. But if it breaks or feels very rough, that's over porosity. Okay. With practice, you will get this. Now, elasticity is very important. That's the ability for the hair to stretch and return to its original length without breaking. This indicates the side bond of the hair. So this is for my people that gets curls. So you want the curl to take, so you want the hair to be slightly elastic. Now, how do you either have low elasticity or what you would call poor elasticity or normal. This is what you do. You just tug a few strands and see if the hair returns back to its original. If it does not, if a client has low elasticity, guess what you should do? That means the hair may have been overprocessed, or it may be the result of poor nutrition or internal disorders. So you may provide a treatment in order to fix that. Okay, let's go here. Alright, here we go. This is your elasticity. Okay, we're going to practice this. Now, let's go back here, which what I skipped over. Okay, these are a few other disorders. Knishes. Knishi is a technical term for gray hair. Okay, you got different types of knishes. Okay, gray hair is due to loss of hair's natural melanin pigment. You got congenital, acquired, or ring hair. Congenital means the gray hair exists at or before birth. It usually occurs in albinos. Acquired means you got it, maybe because of the natural aging process. Ring hair is you got alternating bands of gray pigmented hair throughout the hair strand. Hypertrichosis is another disorder. Hyper means excessive. Trichosis is a study of hair. So hypertrichosis is a condition of abnormal hair growth. An example of that, uh, a mustache on a woman, or maybe like this one says terminal hair, where only vellus hair would normally grow. So you have terminal hair where your eyebrows may be, or anything of that nature. Treatments include tweezing, depilatories, waxing, shaving, mechanical epilators, or electrolysis. Okay. Trichoculosis is the technical term for split ends. Of course, you can remove them by cutting the hair. Trichorexis nodosa is the technical term for knotted hair. How do you do that? What do you do about that? You may soften them with conditioners or moisturizers. So you can see this if somebody has natural locks and they want to remove those locks. You might want to slap some conditioner or moisturizer on it to help with the knotting. Monothrex is a technical term for beaded hair. This is the hair that breaks easily between the nodes. Guess what you do here? Conditioning treatments are recommended. Fragilistic cranium, technical term for brittle hair. Conditioning treatments are recommended. So a lot of these disorders can be fixed with simple conditioner treatments. It's our job as master hair care specialists to understand our client's hair, to be able to analyze properly, and to be able to recommend the treatments to fix whatever disorders that the client may have. Okay. All right. I think we're done. Now, these are some of the things, a few of the things we did towards the last one. We discussed the characteristics of the hair analysis. We identified different types of hair loss. We identified common scalp and hair disorders, their causes, and their treatments. So you want to be very familiar with these disorders because that's going to set you apart from the average barber.